Today is Maternal Health Awareness Day. Maternal death rates in our country are among the highest in developed high-income countries. Our chief health editor, Dr. Nandi, joins us now. And Dr. Nandi, that is a disturbing statistic to hear for us.
100%. And today is all about raising awareness and hopefully improving outcomes for moms and their families. Now, maternal deaths in the U.S. have been rising for 3 decades, Glenda, and the numbers are alarming. Get this, in 2021, over 1,200 women died from pregnancy-related causes, and that's a huge jump from 754 deaths in 2019. Nearly half of the deaths didn't happen during delivery, but in the weeks and months afterwards. And what's even more heartbreaking to me is that roughly 80% of these deaths could have been prevented. So what are some of the complications, right? Well, conditions like preeclampsia, postpartum hemorrhage, and infections are common causes. And chronic conditions such as high blood pressure, heart disease, diabetes, and obesity also increase the risk. But it's not just about the health conditions. There are other factors like provider shortages, limited access to care, lack of mental health resources, and systemic racism, unfortunately. So Black women in the U.S. are especially impacted. Their chances of dying from pregnancy-related causes in 2022 were more than twice as high as those of other women in other high-income countries. And this shows just how important it is to provide better access to quality care and support for all women.
So what can you do if you're planning to get pregnant to keep yourself healthy and safe?
Yeah, an important question, right? So there are steps that women can take to support a healthy pregnancy. First, focus on maintaining a healthy lifestyle. Eat nutritious foods, stay active, and please avoid smoking, alcohol, and drugs. If possible, work with your doctor to address any health issues before pregnancy. Also, regular prenatal care is super important. Schedule checkups to monitor your baby's growth and catch potential problems as soon as possible. Now, follow your doctor's advice for tests and screenings, and don't ignore any new or unusual symptoms. That's important. Instead, track them and discuss them with your healthcare provider. In addition, vaccines like the flu shot, COVID, and RSV are really important for protecting both mom and baby. And now, since many maternal deaths happen in the year after childbirth, postpartum care is just as important. Please continue seeing your doctor, not just for the physical health, but also mental health. Remember, postpartum depression is a real concern, and there's treatment and support available. Remember, again, if something feels wrong at any stage, please speak up. With awareness and the right care, we can reduce the risks and improve outcomes for mothers, families, and communities. Those numbers that are going up, we need to bring them down. I think in a country like this, we have all the resources. We just have to have people getting access.
Yeah, especially that year after childbirth.
Exactly. And people forget about that.
Yeah. All right. Thanks, Doc. Appreciate it.
My pleasure. Of course.
Okay. And then coming up this week on the Dr. Nandi Show, if you're dealing with unexplained fatigue, weight changes, or trouble swallowing, these symptoms underlying health conditions. So you'll be talking about that on your show, Doc.
Absolutely.
A survivor you're talking to as well.
Exactly.
So looking forward to that, looking at the common symptoms. That's this Sunday, January 26th at 5 p.m.